Hello everybody and welcome back to yet another ad hoc video. But this video is going to be different because I'm actually going to be reacting to this amazing company. I hope I have the sarcasm in my voice when I say this. This amazing company. Wait, it's not a company? It's called a DAO, a decentralized autonomous organization. This amazing pseudo company called HairDAO, and how they're going to cure hair loss. Right? And it seems as if in this presentation that we have here, solving hair loss with HairDAO. I'm not sure who this lady is, and I'm actually not going to go in on her because I don't know her complete involvement. I do have suspicions about the founders themselves and also some of their adjacent researchers. So again, I don't know much about the lady in the video, so if there's any criticism here, it really has nothing to do with her. It's more so the project she's representing. And again, this intro is probably going to be a bit long, but I have to lay some sort of groundwork, or some initial criticisms here, right? Whenever you see a company that is trying to be innovative, that has this sort of Elizabeth Holmes Theranos kind of flair to it, sometimes the people who are presented in the forefront aren't exactly the quote-unquote masterminds, and they shouldn't necessarily get our full criticism, right? So you'll come to find out if you do your own research that HairDAO is involved with some notable researchers, Ralph Paus being one of them, and I think Claire Higgins is another. The question that I have here is, how much do they actually know what's going on in regards to some of the shady behavior the DAO's involved with, right? But that will be elaborated at a future point in time. There will be some videos coming out in the future regarding that particular aspect. Let's just get on to this video, right? In this video, HairDAO is essentially going to be showing their research and how essentially they have a pretty cool cure that they came up with. This is a fantastic treatment. So enough of my rambling. Let's see what's actually going on here.
All right. Hello, everybody. My name is Anya. I work at the intersection of crypto and hair loss, which means most of my friends think I've completely lost it. But today I want to convince you guys otherwise, that this approach is in fact quite revolutionary. My background is in the sciences. I did my graduate studies in computational biology and quantitative genetics at Harvard. After that, I went into Web3 software engineering. And now I get to work at the intersection of both as the CTO of HairDAO.
Okay, so she's the CTO of HairDAO. That's pretty cool, and she has a lot of credentials. Whenever somebody says, I want to insert Ivy League institution here, it kind of gives the, the ethos, right? That they're selected. They're very smart. And again, let's, give her the respect. Let's put a bit of a clapping sound effect here. And continue on with the video. Let's see what they're going to be talking about here.
Today I want to take you guys through our journey in the last 6 months and how one of our DAO members went from this to this. In the first picture, this DAO member had tried basically every hair loss drug in the market. That's not 1, not 2, not 5, but 7 different interventions.
Okay, so this is a very amazing improvement, right? I'm just going to put the mouse here, and we're going to see the improvement that this person made. So it looks like they have this sort of odd diffuse pattern in the middle of their scalp, so clearly they're having some loss here. And that's the before picture. In the after picture, the lighting is a bit different, but clearly we can see that the void that was the middle of the scalp is full of what seems to be terminal hairs, right? This is amazing. Now, presumably, this person has androgenetic alopecia, right? That's pretty much the core focus when it comes to hair loss for this particular company, HairDAO. And presumably, this person used whatever treatment that, quote-unquote, these internet friends developed in order to solve this particular person's hair loss. So, as the caption says here, did internet friends just develop a drug, right? That solved this particular person's hair loss issue, and I guess this person is part of the DAO, the HairDAO project, so it looks like they've made some decent improvements in terms of the before and after. So let's let this person speak.
He was feeling quite hopeless, quite depressed, and this is him after 6 months of taking our proprietary treatment. He's
Okay, so this is the person in the Dow who was having hair loss. This is them after 6 months, right? So this goes to show how potent whatever this drug that these internet friends and hair Dow developed. That's pretty impressive. Let's give them the props here. If this is actually true, if this person actually has androgenetic alopecia, this is an amazing improvement. In fact, I would even say if this is the improvement from their developed, proprietary drug as a cryptocurrency a cryptocurrency group, that would mean that they essentially beat minoxidil and beat finasteride with this proprietary drug that they developed. So this is pretty cool.
Feeling excited again. He feels like he has a new shot at life. And I'll take you through how exactly we did that. But first, I want to put this all into context. So hair loss affects a lot of people. And I was wondering if you in the audience, if you have either experienced hair loss or know someone that's experienced hair loss, could raise your hand.
Okay, so there's a lot of backstory to people who aren't familiar with what's actually going on here. I will say though, like, this is very interesting. Pay attention to this account over here, Tristan Tate, along with SG2000. This person says, I'm going crazy 11 months after, I guess that's hair transplant, HT, and still thin over there. It's shedding or some telogen effluvium. I want to kill someone. Okay, that's it's pretty interesting statement there. Yeah, I mean, priorities, right? I'd personally be willing to kill for hair. I think these guys really do mean it. When this person with the username Tristan Tate was recently raided by the FBI. Again, that sounds like I'm making up random points, but that will be explained sometime in the future. This Seattle, Washington fellow who was making threats on a Discord server, talking about doing a school, let's just say school targeting practice with a rifle in the United States. This fellow that said that, whatever. Let's not harp on that too much. But over here, as you can see, members of their Hair DAO project are saying how much hair loss has impacted them, right? And many of these people can't, use the drug finasteride in this group. In fact, if you look over here at this 1843 magazine citation, it says, quote, would you risk a breakdown to cure baldness? Thousands of men claim that finasteride has given them devastating and long-lasting side effects, which I'm sure they'll be touching on later on in this video. But as you can see, this hair DAO people, they believe that finasteride, can cause debilitating long-term side effects even after you're done using the drug. So they do believe in the post-finasteride syndrome proposal, I guess you can say, theory, right? That finasteride is pretty much a risk if you take it, and it can be very dangerous. So let's hear what she has to say.
Yeah, so if you take a look, that's a lot of people. And in fact, it's 80% of men over the course of their lives and 50% of women, right? And so they'll spend billions and billions of dollars annually to try to stave off their hair loss and regrow their hair. Which begs the question, why do we not have a solution? Right? And so often it comes down to incentives. In the early stage, most funding comes from the government, so money is allocated in a utilitarian fashion. Most of the money will go to the conditions that most of the people struggle from. Now, hair loss isn't classified as a disease, so it virtually gets no allocation in the early stage. In the later stage, you might be wondering, okay, why does the pharma industry not invest in this? I mean, they must be licking their fingers at this opportunity. But again, similar story. It's not classified as a disease, so they actually can't get any reimbursement. And what that means is, again, they don't have the financial incentive to do anything about it.
Okay, so this seems kind of strange. Initially, she says that this industry, people spend billions of dollars yearly in order to treat their hair loss, in order to have a hope in slowing down their hair loss progression or even growing hair. Okay, that's all fine and well. But at the same time, she says that the pharmaceutical industry is not incentivized in coming up with treatments or cures or, effective whatevers in order to ameliorate the condition of hair loss, whether it's from androgenetic alopecia or, maybe other hair loss concerns, right? Again, I hope, they are a bit more, how do I say, clear. And when they talk about hair loss, they're specifically talking about androgenetic alopecia. Okay, that is a cosmetic concern, right? But there are other alopecias that are based in autoimmune conditions, like Lichen planopilaris and its various variations, even alopecia areata. But to say that because pharmaceutical companies can't get reimbursements, and I'm assuming she means reimbursements from insurance companies, that this will cause them not to research into the conditions of hair loss, whether it's androgenetic alopecia or what have you, because it's not considered a disease. That doesn't really make any sense, right? A pharmaceutical company will make a drug that it thinks people will buy, regardless if they're going to get reimbursements from insurance companies. And I think, there's some sort of disconnect. I'm not sure what she means, again, by reimbursements. Does she mean... And by the way, she's speaking from a very United States-centric kind of position, but when she talks about reimbursements, does she mean reimbursement to healthcare organizations? Because oftentimes when healthcare organizations give a treatment for a particular ailment, let's say you go to the hospital and you break your arm, they need to be reimbursed by your insurance if you have an insurance policy. So they essentially call up your insurance company, or they fill out some forms, and then the insurance company, gives them a bill coding, and the bill coding should match the sort of treatment that you got. So they may have a specific code for, okay, so-and-so broke their arm, Johnny broke their arm, so this means that we have to give you bill coding, let's say 47-AB. And 47-AB is the monetary reimbursement that the healthcare organization gets by treating you, right? So they're billing your insurance company. But I don't know why she's talking about pharmaceutical companies not getting reimbursements from treating hair loss conditions. If you look at Eli Lilly, they came out with the drug Olumiant, originally used to treat, I think it was some sort of arthritis condition, rheumatoid arthritis, an autoimmune condition. That's what it was initially researched for. But because it's a JAK inhibitor, it, suppresses the immune system to some extent, and alopecia areata is a condition where your immune system suppresses your hair follicles' ability to grow. They knew that if they were to research into areata and have good studies and prove its safety and efficacy, that they can possibly get a version of Olumiant, also known as baricitinib, onto the market to treat alopecia areata and to get that FDA, the US FDA approval for treating alopecia areata. Well, obviously they got that, and obviously there was an incentive for them to do that, because there are a lot of people that deal with alopecia areata and even adjacent autoimmune hair loss conditions. These pharmaceutical companies aren't dumb, they know that. But at the same time, insurance companies aren't going to, rightfully so, reimburse patients who have a quote-unquote cosmetic issue, right? We can debate, a condition like alopecia areata is an autoimmune illness, right? Okay, it causes profound cosmetic changes to the point where you can lose hair all over your scalp or even all over your body. However, because it's an autoimmune condition, it could be correlated with other issues as well, right? There was a paper by The Lancet, and in that particular paper, it stated that people with autoimmune conditions, like one autoimmune condition, right, are likely to have other autoimmune conditions as well. So usually people have two autoimmune conditions. So there's a case to be made for a condition like alopecia areata, it being covered by insurance, but it's not. However, these pharmaceutical companies don't want their drug to just sit on a shelf somewhere, right? So they have programs where they work with patients on reducing the cost. They will give the medication to patients who have these issues, who cannot afford it, at a very reduced cost. So it goes from something like $300 a month for a 30-day supply of Olumiant baricitinib, the JAK inhibitor, and then it becomes like sometimes $15 or maybe $5 a month. So these pharmaceutical companies have an incentive of seeing their drug being used if they researched it for a particular purpose and they have been approved for that purpose, right? So to say that the pharmaceutical industry, big pharma or whatever, is not really incentivized on making an effective treatment, first off, finasteride and dutasteride are pretty effective treatments at the moment, so that's probably why they're a bit sluggish. But even in that regard, right, we have companies in the biotech field, like Amplifica, for example, who just made a recent announcement about their AMP303 osteopontin derivative that seems to have promise. Or you also have Kintor Pharmaceuticals with GT229 or KX826 pyrilutamide, right? You also have Technoderma, I think that's what they're called, with their thyroid mimetic sort of topical, right? You have all these companies that are sort of still researching, still coming up with a proof of concept that is actionable, right? To the point where a bigger pharmaceutical company may come in and buy that intellectual property to further research and get to the market. And another point that I want to make here, we don't necessarily need money going directly into hair loss treatment in order to get breakthroughs that are applicable to hair loss treatment, right? So if you look at Amplifica, I keep going to Amplifica as an example, Dr. Maxim Plikus, who made the discovery of these sort of secretosomes from the hairy nevi, the moles, right? The osteopontin, the SCOOP3, and other sort of molecules that goes to fueling moles, these senescent cells, into growing hair, that came out of a grant that was, to my knowledge, originally for researching tissue regeneration, right? And look where it has gotten us. Because we have research in adjacent fields, breakthroughs in those fields can be applicable to other sort of fields, right? So if you're doing research in tissue regeneration and organ, cloning and stuff like that, whatever research you find there is very, very applicable to hair loss treatment, whether it's hair loss, treatment by cloning new hair or by reversing the damaging effects of DHT or by some other mechanism, right? It's very important that we acknowledge this and we don't have this sort of, closed off view of what actually is going to the hair loss industry. Because when people present that sort of, I guess you can say, narrative, it makes it sound like there's no research in the field at all. So be very cautious of this company HairDAO and how they present things.
This has left us with inadequate solutions. There's minoxidil or Rogaine. This is considered the gold standard of hair loss treatment. It was actually originally an ulcers drug and a hypertension drug, but had the happy side effect of regrowing hair in some people. The problem is with minoxidil, it actually, depending on what study you look at, doesn't work in 30 to 70% of people, right?
Okay, so I know there are going to be people in the audience who have the instinct of saying, that's true, minoxidil topically didn't seem to work for me. What you have to remember is, when you have androgenetic alopecia, especially when you've gone long-term without treatment, your hair follicles are cooked, right? DHT has been targeting your hair follicles and has been diminishing its potential to actually produce hair. So in doing so, your hair follicles aren't normal by any extent. So the potential growth benefits you could have gotten on minoxidil are very much hindered. Now, okay, it is true. You need a certain enzyme called the sulforotransferase enzyme, or the SULT1A1 human variant version of the enzyme, in order to convert minoxidil into minoxidil sulfate, which is known as the prodrug that goes to growing your hair. Numerous studies have sort of shown this. However, we have to, keep things in perspective. 30 to 70% of people, quote unquote, not responding, that's kind of a big range. And whenever you have a, a big variant of somebody saying, well, 30 to 70% of people don't do this, question why that range exists in literature. And that pretty much is when you have long-term studies concerning topical minoxidil use, or even, I guess, oral minoxidil, if there is studies that are long-term with oral minoxidil. But in general, when you have a long-term study with minoxidil use in the field of androgenetic alopecia, eventually minoxidil's benefits wanes over time. Why? Because of the debilitating effects of DHT to the hair follicle in the condition of androgenetic alopecia. If you're not solving the underlying condition, right, eventually DHT will damage the hair follicle to such an extent that it can no longer produce viable hairs that can be stimulated by minoxidil or the prodrug minoxidil sulfate. So there probably are a bunch of responders out there who aren't getting the full benefit benefits from minoxidil, even though they may have the necessary sulfuryltransferase enzymatic activity to necessitate that we have more minoxidil sulfate being directed to the hair follicle. There probably are people out there who do have that activity. However, DHT has damaged their hair follicle to such an extent that those hairs can't properly be stimulated, and that's what should be noted here. So when you give the perspective that, oh, minoxidil doesn't work, or it doesn't work in most people, you have to contextualize. It doesn't work, and it doesn't work especially if you're not solving the underlying condition of DHT, right? But if you're using a 5-alpha reductase inhibitor like finasteride or dutasteride along with topical minoxidil or even oral minoxidil, right? I know on this channel I tell people to be cautious of oral minoxidil, but it's still, you know, pretty effective. Then you have to understand that these drugs go hand in hand, and trying to sort of separate them and view them on their own isn't very useful, especially in the case of minoxidil, because long-term androgenetic alopecia will ultimately hinder the efficacy of minoxidil, whether it's topical or oral. But not only that, you can use topical retinoids like tretinoin or adapalene to stimulate the sulfuryltransferase activity on the scalp while you're using topical minoxidil, right? So this seems, you know, pretty ridiculous. I've also heard some recent protocols where people use low-dose Accutane. By the way, I'm not advocating for that, but there is some protocols that some dermatologists explore with by using low-dose Accutane or oral isotretinoin in conjunction with oral minoxidil or topical minoxidil at that, in order to stimulate more sulfuryltransferase enzymatic activity in the tissues, specifically the scalp. So trying to present the current treatments as we have as being wholly ineffective is a bit disingenuous, and it kind of goes to show the sort of framing and contextualization that they're trying to set up in order to promote whatever sort of treatment they're coming out with. And to be fair to HairDAO, I know I'm a quote-unquote HairDAO hater, but to be fair to HairDAO, a lot of pharmaceutical companies also do that as well, right? We're seeing with Hintor Pharmaceutical Limited, for example, they spent a whole while, a long time, saying that, oh, KX826 pyrolutamide is better than finasteride because finasteride has nasty side effects. Not knowing that, you know, people will also be complaining about your topical anti-androgen, and rightfully so. Although it has been proven as safe in recent studies, you're still doing a sort of mechanism of action that involves blocking the androgen receptor, right? So somebody, even though they're noceboing themselves, they could rightfully come up with some sort of mechanism of action that justifies their nocebo effect, or let's say an impact to their libido. All they have to do is point at, you know, the pharmacological intervention of you blocking that androgen receptor. So again, a little bit of a walkaway point here is that HairDAO is being completely disingenuous here with this point, right? Okay, minoxidil isn't the most effective hair loss treatment, but it isn't ineffective to the point where you have, quote unquote, 30 to 70% of people, depending on what study you look at, the drug being ineffective. Let's be honest here in how we frame things.
Right, so it's not a solution for most of us. There's finasteride, which is actually more effective, but the problem is A, women can't use it, and B, it comes with some really nasty side effects. We're talking erectile dysfunction, infertility, and depression. So one of our DAO members, he actually shared his story, and he got so depressed taking finasteride, he actually had to quit his job. And there's something called post-finasteride syndrome, so the symptoms don't necessarily go away when you stop taking the medication. So after quitting his job, he had to move back to his hometown to live with his family, right? And people are willing to take these medications because that's how much they care about regrowing their hair.
And now they're going to the point about finasteride not being safe because it has a shit ton of side effects, and these side effects are so prevalent, at least how they're portraying it, that it's a public cause for, you know, it's a concern. It's a concern that they have. I'm not going to say that finasteride doesn't have any side effects. It can have side effects. It has been noted in the literature to have side effects. But when it comes to this whole post-finasteride syndrome, where even after you're done using the drug and it gets out of your system, there's a prolonged effect, and, you know, you have these crazy impacts to your body such that it could potentially be permanent, that isn't in the literature. And there's so many studies that goes to proving the contrary. In fact, a recent meta-analysis by Larry et al. 2024, I'll try to put it on the screen here if I remember, shows that there, in 2,213,600 something patients, it's a very robust meta-analysis. There's no correlation between dutasteride and, finasteride to depression and these sort of post-finasteride syndrome issues, right? It seems to be that the issue here comes from the reality of dealing with hair loss, right? There will be people who go on to talk about, but, what about the neurosteroids, right? What about this rat study where they gave a rat 5 grams of dutasteride or finasteride, and then the rat, was acting different. Now, let me tell you this, guys, right? If you are a rat and you are taking 5 grams of dutasteride, the human equivalent of that, I will believe anything you tell me. No, I really mean it. I'll believe anything you tell me at that point. Even if you tell me that you have neurological side effects. Because taking 5 grams, the equivalent dose, the human equivalent dose that they give these rats, 5 grams of dutasteride, or 5 grams or 3 grams of finasteride, is so beyond the normal everyday use of it being a milligram, whether it's 1 milligram finasteride or 0.5 milligram dutasteride up to 2.5 milligram dutasteride. It is so large to take a gram that if you are taking a gram, I think the talk about, impacts to neurosteroids are very much possible. However, we have the blood-brain barrier, and we have other principles that prevent there being a significant accumulation of finasteride or dutasteride in the cerebral spinal fluid to the point where it's impacting neurosteroids. You can find studies that sort of show that, okay, that's happening, right? To my knowledge, at the moment, from what I remember, there was this one study involving women and I think some sort of menstrual cycle disorder or PMS or whatever they call it. And the researchers were saying, oh, we give women 2.5 milligram of dutasteride, and it was able to cross the blood-brain barrier and get into the cerebral spinal fluid, and it modulated their behavior such that they had good outcomes. Now, I'll make a video on this study in the future, but from what I remember, they didn't even get blood work from all women in the clinical trial. Not only that, but there were some issues with the sample size, and even the women that didn't have that sort of menstrual cycle disorder, they weren't impacted negatively by taking the 2.5 milligram of oral dutasteride. So what I'm trying to say here is there is not a lot of literature that proves the existence of post-finasteride syndrome. You can talk about, all these pathways, but if you don't have an etiological sort of description of post-finasteride syndrome that we can prove, if you don't have a good study that backs it up, then at the moment, that doesn't exist, right? In fact, there's more data to the contrary of post-finasteride syndrome's existence. So this sort of hair DAO, diligent researchers here, you have to ask yourself, why are they so gung-ho about supporting this sort of PFS condition, all while ignoring that the literature, the medical literature, doesn't show its existence? It seems as if having this sort of narrative is beneficial to whatever they're trying to push onto people.
People care a lot. There's also hair transplants. This is a good solution if you have 15K to spare and are willing to get a new one every 4 years. But for most people, it really isn't an option.
Now, this point is so asinine. What do you mean that you have to get a new hair transplant every 4 years? Okay, let's say that you have to get a hair transplant to fill up, parts of your scalp. So let's say you're a Norwood 6 trying to get to a Norwood 3. Obviously, you can't just sit there in one session and do a mega transplant of, 10,000 grafts. That wouldn't be healthy for you, and that wouldn't be healthy to your hair follicles that you're trying to transplant into the balding region. I don't think that's what they're getting at here. They're essentially saying that hair transplants don't work regardless, right? And you're going to have to get a new hair transplant every 4 years. That's the framing that they're trying to go here, this hair Dow project. Now, that probably is true if you're not using, medicine, if you're not taking your medicine. If you're not using a 5-alpha reductase inhibitor to prevent your androgenetic alopecia from getting worse, then you will have to get a hair transplant, quote unquote, every 4 years in order to fill up, the ultimate or inevitable outcome of your hair loss progressing upon the point of where you had the hair transplanted to, right? Androgenetic alopecia is a progressive condition. That's what's going to happen. And also, if you have a condition aside from androgenetic alopecia, like an autoimmune illness, an autoimmune hair loss condition, like Lichen planopilaris, this is a scarring alopecia, you aren't a good hair transplant candidate. You need to take corticosteroid injections. You need to do, possibly PPAR or PPAR gamma agonist treatment. So that means either taking, pioglitazone, or I think the other one's called rioglitazone or whatever. You need to take those medications in order to stop the progression of that scarring alopecia. Or maybe you have alopecia areata. Again, corticosteroid injections, or taking a JAK inhibitor, or using a topical corticosteroid like clobetasol propionate in order to treat that condition. If you have any condition outside of androgenetic alopecia, you have to solve that issue first before you get a hair transplant. But again, these guys at Hair Dow aren't that complex. They don't like to think about adjacent hair loss conditions. They're solely focused on androgenetic alopecia. So I think she's presenting that, hey, whether you're on treatment or not, with androgenetic alopecia, you will have to get a hair transplant every 4 years. Now, the cost of a hair transplant is very contingent on where you live. Ultimately, if you're in the United States, yes, you will be spending a pretty penny, depending on how many grafts you have to get. So it could be $10,000, even $15,000. So what she said there was correct. However, that's, it doesn't really matter, right? I know I'm saying it doesn't really matter, but if you get a good result, if you go to a good hair transplant doctor, and if it really means that much to you, you will take the medication. You will make sure that you do only have androgenetic alopecia by getting a scalp biopsy first before you do the transplant. And if you do only have androgenetic alopecia, then hey, let's take the medication. Let's take finasteride, especially dutasteride. Let's slow down the progression of that hair loss, and let's get the necessary hair transplants to give you that full head of hair or that decent coverage. But she's not presenting it that way. She's saying it's like an inevitable outcome, that you will lose your hair even if you're on finasteride or dutasteride in the condition of androgenetic alopecia. And again, that's such a dishonest way of framing things that you have to ask yourself, what are these people trying to push on you? Be very critical of that.
So we decided to come up with a solution of our own. This is actually one of the co-founders, Andrew, who is willing to share his results. What you see here is that he increased 24 hairs per square centimeters with our proprietary topical. To put this into context, the gold standard minoxidil regrows about 15 hairs per square centimeter, and finasteride 18 hairs per square centimeters in a 2017 meta-analysis by Godwin and Adol.
Okay, that really doesn't mean anything. I get it. 24 hairs per square centimeter is amazing, especially in 6 months, right? But if you don't have a placebo group to test, the baseline, right, to compare it something to, then how do you know if your golden treatment is responsible for producing that many hairs, right? Sometimes you have seasonal variation in hair count, and that can cause for you to get more hair in certain seasons, right? But another fact here is that in many hair loss treatment studies, you often see the placebo group gaining hair. And again, those hairs are seasonal in terms of variation. So you have to make a comparison between the placebo group, the group that gets no treatment, and you have to compare it against the group that does get treatment. And essentially, you kind of have to subtract the gain in hair count in both of those groups, right? So let's say if they had another group where they had an increase of about 12, right? 12 hairs in that placebo group. You would compare the two, right? You would subtract the 12 from the 24 in the treatment, and then you would say, okay, so it seems in our study that we had a 12 hair increase per centimeter squared, right? But because they don't have a placebo group, it's kind of useless. It could be the case that the treatment doesn't even work at all, and that this was just purely due to seasonal variation. Another point to keep in mind here is the quality of the hair that grows back. It doesn't matter if you're getting an increase of target area hair count by increasing the number of vellus hairs you have. Vellus hairs are thin, wispy, often colorless hairs that have no real cosmetic benefit. So what we care about are non-vellus intermediate hairs, so hairs that aren't vellus but aren't necessarily strong hairs. And we care about strong, healthy terminal hairs. These hairs are hairs that are cosmetic and are beneficial. These are hairs that we can style. These are hairs that we can readily see without making too much of an effort with the naked eye. But it's very shady. Again, they don't have a placebo in this particular study. And what I find to be crazy is that this is the co-founder. I'm assuming it's the co-founder Andrew Verbinen, because on his Twitter, I'm not going to really show too much of that. But on his Twitter, he was showing how he was using the treatment, this sort of treatment that they made themselves, on his own scalp. But I find it strange that you're using the co-founder as a way to promote the efficacy of your treatment. Let's not do that. Let's get subjects from your study, and let's use the treatment group and the placebo group and kind of compare them to one another, right? Let's try to get some solid data rather than just saying, oh, here's the co-founder and here's his improvement, even though we are not comparing it against any sort of placebo group. So again, very questionable. Why would they do that? What are they trying to push to you?
And these pictures, by the way, are taken with a tricostan. That's a state-of-the-art device. It's used by hair transplant specialists, and it'll actually count the hair as well as the volume and the density. And actually, in everybody we've measured so far, we've had increase on both of these measures. So the part that's interesting for you, I guess, as well, is how did we get there? And the reason this might be interesting is that you will hopefully be able to use this as well if there's any condition you're suffering from or a loved one is suffering from. And as so often the case with DAOs, it all starts with community. We have a community of over 1,500 individuals who suffer from hair loss.
You can join their Discord server. It's mostly just the same people being active over and over again. Nothing wrong with that. But maybe that's a bit of a cheap point to get at, so I'll let her continue.
These people are frustrated because they have tried everything that's on the market. They're citizen scientists, which means that they themselves have decided to learn everything they can about hair loss. And in doing so, have acquired more knowledge than some of the dermatologists that are, active in the space. And the people who work with us are impressed over and over again just by the depth.
There are some people in Hair DAO, just, some average, I don't want to say average, but again, the citizen scientists, so to speak, who are more knowledgeable than your typical dermatologist. And I can give them props to that extent, but also I do have to kind of chastise the field of dermatology here, especially some dermatologists. As soon as they graduate, they're not trying to look at the literature at all. And in fact, some of them kind of push bullshit treatments onto patients. And, it's the whole PRP. Oh, I'm not going to give you finasteride. Let me give you platelet-rich plasma therapy instead. And then you ultimately, waste time and waste a lot of money on a treatment that isn't even standardized and isn't really proven to work. So again, a lot of dermatologists are kind of a bit washed out, so to speak, but there are many who are really good too, right? Don't get me wrong. Especially those sort of university research dermatologists who have their own practice as well. In fact, I say if you can get those kind of dermatologists, that's great. You can go to them and they'll more often than not be aware of the studies and the current, research at hand. Another point to make is that there are just fields in dermatology that are just very, very lackluster, and this is in regards to biopsy research. When it comes to conditions like Lichen planopilaris, there was this one paper by the Mayo Clinic, I guess 2 papers actually, that really just made me kind of stand out of my seat and say, what the hell's going on here? And it concerns scarring alopecia Lichen planopilaris. In one paper, the paper in the abstract, if I can recall correctly, I'll put that sort of screenshot on the screen. It essentially said, we're trying to see the hormonal implications to Lichen planopilaris. So we intentionally excluded men from this study in order to focus on women who are, postmenopausal, because that seems to have an impact on Lichen planopilaris or something like that. So they're already coming with the presumption that Lichen planopilaris is something that inherently impacts women, especially post-menopausal women, which is kind of a bad starting point. But not only that, they had another study, the Mayo Clinic, that said in about 300-something thousand, people, patients, we only noticed 34 of them had Lichen planopilaris. I ask this question, and this question is, how many of these 300,000 odd patients, right? This robust patient population, how many of these patients were assessed with biopsy in order to know their cause of hair loss? Very often, when it comes to treating conditions of hair loss, you just get initial, a clinician assessment where the doctor just looks at your scalp and says, okay, it looks like androgenetic alopecia because it has this sign, whatever. Take finasteride, take dutasteride. And very commonly, right, it could be the case that that's all, that needs to be done. However, there are some people who could also have other conditions on top of their androgenetic alopecia, or they could have conditions that mimic androgenetic alopecia, such as Lichen planopilaris mimicking typical NORD patterns of androgenetic alopecia, or frontofibrosing alopecia, which is sometimes in men mistaken to be, common NORD progression of androgenetic alopecia. If you're not having a biopsy where they go in, they take a small sample of the tissue and they look at the histological signs of a scarring condition, or the typical signs of lymphocytic infiltrate that you'll see with alopecia areata and even subforms of Lichen planopilaris. If they're not doing that, you're not getting an honest assessment of what the condition actually is. So let's be, made aware of that. So again, yeah, I could see that there are some quote-unquote citizen scientists in HairDAO who may know more than your very typical dermatologist, but that doesn't say much about HairDAO. That says more about the dermatological field, right, when it comes to treating patients. So don't give them too much props, but I guess we can give them a degree of props.
So they'll propose study ideas because they know the biology so well, and will be rewarded with hair for all their contribution or token. And
so I just want to get this point straight, because in the future I will be having some videos coming out about this particular group. But these people who are part of the DAO, right, they're effectively employees. This is a business, right? So when it comes to the Security and Exchange Commission, when they assess HairDAO, they're not going to see it as some sort of decentralized autonomous organization. DAOs are rarely decentralized. Rarely are they autonomous. And most definitely they are organizations. They are business organizations. And we know this because, as this lady, the CTO, explained, there is this sort of common enterprise where all of these sort of people are coming together in order to do collaborative research with one another, in order to come up with study designs, and not only that, but they're being paid in a crypto token. They're being rewarded in their hair token. These are effectively employees, whether you want to admit admit it or not, this is important when it comes to investing in a particular project like HairDAO, right? And you have to be very careful if you're putting your time or your money into this project, or if you're buying the token, or if you're investing in it. Be careful, because you could very well lose a lot of money in this sort of, endeavor. So that's why I kind of caution people about jumping into the crypto space. I will admit I'm somebody that owns crypto, right? But I'm aware of the risks that comes with owning cryptos, and I'm also aware of dealing with this sort of decentralized autonomous organizations. Be careful. They can be very seductive in how they present things. They can say that, oh, you're going to get a portion of our intellectual property. You will be getting paid. But not always do they have to honor that sort of, agreement, right? Now, they are essentially, in my opinion, a security in how they're giving out their tokens and how they're making these implicit promises of, breakthroughs and foundational research and essential payment to the people who contribute or make common enterprise towards solving hair loss or coming up with a cure or some sort of profitable treatment, right? You can kind of see it over here on the screen. You have scientists and patent ecosystem. You have them actually doing the research in the lab or whatever, the intellectual property portfolio, so whatever they produce from the lab, and then you have this sort of telehealth thing that they're going to make. Yeah, just be careful in getting involved with this sort of hair loss cryptocurrency field, because it's pretty shady and it can come at the risk of your health.
When these studies are proposed, the community can actually vote. And this is quite brilliant, because no one's incentivized to vote better than somebody who thinks day and night about regrowing their hair. Once this is done and a study is voted for overwhelmingly by the community, it'll go to our lab, where we test, whatever the intervention is on ex vivo human hair follicles. And if it indeed happens that some of the hair regrows and we have some, efficiency data available, it'll become part of our IP portfolio.
So she explained it pretty thoroughly. That's essentially what's going on there in HairDAO. Now, I'm done with this sort of bullshit presentation. I'm calling it bullshit because that's really what it is. What they're hinging on is this particular sort of treatment that they're coming up with, that in the founder who tested the treatment out, they increased their hair count by 24 hairs per centimeter squared in 6 months. And not only that, there is no placebo group, so you can't adequately say that it was because of their treatment. I'm sorry, but that isn't always the case. Also, over here, let me go to that part real quick. This part where one of their DAO members tried a treatment. Hey, do we have a biopsy proving that this guy has androgenetic alopecia and not some sort of autoimmune condition? Maybe they do, maybe they don't. But again, they leave a lot of information out that is pretty important if you're going to be dedicating your time or if you're going to be putting money into their cryptocurrency hair loss research. Now, they did do a patent with Dr. Ralph Paus of, I think his company is called Catanian. So you can see this on Google Patents. This application was filed by HairDAO Payments LLC. That's kind of strange. I've tried to find this particular naming convention for their LLC. I haven't been able to find it. Maybe I'll do a bit of research later on. But it's in collaboration with Catanian. So if anything happens to you, if you need any sort of legal recourse, these are the two companies you should be going after. And again, you can hit me up. I'll be happy to give you further information if you are injured by using any of their products. I'm here for you. I can give you that information right away. But essentially, they were coming up with this topical composition for treating hair loss and I guess preventing gray hair. Using some ex vivo human skin or whatever, right? Going to that paper, it pretty much involves using topical thyroid hormone, specifically T3 and T4, and maybe some sort of other proprietary elements in a specific compound. And this somehow is supposed to, prevent gray hair or grow back hair from thinning hair follicles. And that's pretty much what they're using in this specific video, right? That's pretty much what the co-founder used himself. Andrew, I think his name is Andrew Verbinen, not dox, publicly stated by himself. Even though they try to dox me myself, it's whatever, right? But yeah, this is essentially what he used. So be very careful when dealing with this company. They sound like mavericks. They sound very innovative. But as you can see from what I've shown you, they're not being fully transparent with what they're trying to show the public. And I will be having videos that comes out. Sorry, I can't speak. I will be having a video series that comes out regarding this particular DAO. So I know this video has gone on long enough, and I know there's going to be people from the Hair DAO organization listening to this video, but it's whatever. They're probably the biggest lovers of my channel for them to be listening this long into the video. But I want to say, if you did get to the end of this video, thank you so much for watching it, and stay vigilant. Don't expose yourself to whatever chemicals they're going to be giving you. But if you do want to buy or get on their list, I think in November 27th, 2024, they should be launching, if I'm not mistaken. You can come to this website called anagen.xyz. Let me see if I can adjust the screen. Yes, anagen.xyz, and you can sign up and you can, get on their newsletter and buy their proprietary treatments. And if it works for you, that's fantastic. But if you get hurt, you can call me and I'll give you the details on what you need to essentially do to get your bag. So in any case, thanks for watching this video, guys, and I hope to see you in the next one. Peace out.